That's right. We're outside the Jackson Women's Health Organization, set to shut its doors in just a matter of days. Now, since that landmark ruling, there's been no shortage of speculation about what rights women will have to make their own decisions about their bodies. The State Medical Association urging women to relax and remember that that sacred patient-physician relationship won't be compromised no matter what.
The physician-patient relationship is the cornerstone of our practice, and we will respect that.
The president of the Mississippi State Medical Association urging women of childbearing age not to panic over the U.S. Supreme Court ruling in a Mississippi case that outlaws abortion in the state.
I think what I hope people will do is just take several deep breaths and realize that we're going to continue to give the care that needs to be given.
Dr. Jerry Weiland says no matter what happens in the abortion case, doctors won't compromise the fundamental rule that protects patients' privacy.
Is there a concern that patients may be worried that their doctors may snitch on them if they have to terminate a pregnancy?
I know that there must be that concern out there, but physicians in the state are going to take care of those moms if there are problems with that pregnancy.
Dr. Weiland says some pregnant women already face tough choices to terminate a pregnancy.
As much as we always love to have a healthy baby come from every pregnancy, that doesn't always happen. We have miscarriages, we have ectopic pregnancies, we have babies, fetuses that are not viable. Now,
preserving the life of the mother is only one of two exceptions in Mississippi's trigger law, which is set to take effect in 1 week from now. Lawyers representing the clinic believe that law is unconstitutional, and they filed suit in Hinds County Chancery Court to stop it. Live in Jackson, Ross Adams, 16 WAPT News.